Hello, everyone, and welcome back to the podcast. Today, we have Dr. Allison Yantzi with us. She's an emergency doctor that works at emergency departments in Grand River Hospital and St. Mary's General Hospital in Kitchener, Ontario. We're very happy that she has joined us today. Welcome to the show, Doctor.
Thanks for having me.
So I guess just to begin, could you describe why you decided to become a doctor and how you got to working in emergency departments specifically?
Sure. I always liked science and physiology and such, so medicine was always kind of on my mind. I did a kinesiology undergrad degree and just really was fascinated by how the human body worked and was supposed to work, and how when it doesn't work properly, how impactful that can be. And that's kind of ultimately what pushed me into medicine. And then while I was in medical school, I didn't really know what specialty I wanted. I was pretty open. But it's one of those things, like some people will say different things, but you kind of find the place and the people that sort of just kind of jive with you. So when I did my emergency rotation, it just kind of, the people I just seemed to get along with. I enjoyed the work. I like shift work, actually. I like working like nights and weekends if it means I occasionally have weekdays off. And that when you're working hard, but then when you're done, you're done. You go home and you're sort of free of everything. So, and it's, you can see literally anything at any time, from, a little kid with something really minor to someone who's critically ill, or even like actively, critically ill. So there's lots of variety, and it's a lot of things, but not boring, that's for sure.
Yeah, so you talked a little bit about it, but could you speak to a little bit more about what it actually means to be an emergency department doctor and what kind of work you do?
Yeah, for sure. So like I mentioned, so we do shift work. So every department's a little bit different, but this is pretty uniform. So I show up for my shift, and basically if anyone's ever been to emergency departments, you come basically, anyone can come with anything. And the departments I'm in are general hospitals, so it can be kids, babies, all the way up to adults. And we take, obviously, any problem anyone has, we take. There's nothing that we say, oh, we don't see that. So as over the course of your shift, it's pretty variable. You'll see a couple of cuts that you need stitches, and then we have sort of a more acute time, a resuscitation time. So if someone's really sick and needs more intensive treatment, then we look after those people. And it's a lot of sort of triaging, who is well enough to just have treatment and go home, who is sick enough that needs to come to hospital, what service or treatment do they need? Do they need a surgery? Do they need an internal medicine? Like a hospital bed that needs further investigation. So it's a lot of just sort of, where do people ultimately go on sort of getting things started. Mm-hmm.
Yeah, so you mentioned that you treat like a wide variety of concerns. You treat minor injuries to more like life-threatening conditions. Mm-hmm. How has COVID-19 kind of impacted your responsibilities in the emergency department?
Yeah, it's almost hard to tease it out, because I feel like it's impacted literally everything. But I guess from the start, when it was more stark, so when the pandemic first started, a lot of people sort of stayed away from the emergency departments. Everyone was staying home, sort of didn't want to go out if they didn't have to. So interestingly, I actually got quite quiet. There weren't a lot of people coming in, but the people who were coming in were like, they really needed to be there. They were really quite sick. So it was fairly intense shifts. And a lot of our responsibility now, aside from what we were already doing, which is, treating patients and taking care of them to the best of our ability, but now we're that extra layer of keeping them safe. So making sure and as well as us and our staff, the rest of the staff. So wearing our PPE, making sure if someone screens positive for a potential COVID symptom, that they're in the appropriate place so that they're not potentially spreading COVID to other people in the department. There's a lot of, how do we put people in the right place in the hospital too? So, if they're being admitted, what floor do they go to, the COVID floor or non-COVID floor? And just a lot of sort of resource management. And then as well, just how we set up our department now too. We sort of divided it up to, COVID, non-COVID, and it's crazy. It looks so different now. We've put all these plastic sheets in, so we've made a lot of rooms sort of a negative pressure, where we only had one negative pressure room before for sort of infectious diseases. Now we have 6, and we sort of makeshifted them. So there's all this sort of plastic wrap, and everyone's just being really resourceful, trying to come up with the best things possible as quickly as possible, but also doing it with as much evidence as we have, and just trying to keep everyone safe.
Yeah, so I'm aware that you work at Grand River Hospital and St. Mary's General Hospital. Could you talk a little bit more about how the pandemic has impacted those centers specifically, and how they have kind of received and adapted to the new environment?
Yeah, for sure. I mean, I think we're not unique. It's pretty similar across the board. Kitchener-Waterloo, we've definitely been hit hard. Certainly not as as intense as sort of the GTA and Peel region. That said, we're also dealing, though, right now, anyways, people being transferred from the ICUs, from the hotspots to our ICUs. So even though we're not necessarily, we are definitely seeing COVID come into our ERs and getting admitted. There's not, like, even though those ones are getting, there's even more coming from other hospitals that are filling up our hospital more than just what's coming through our own doors. So just trying to manage that. How do we, look after the rest of the province and help make sure that we have beds available for everyone, but also making sure we're looking after our own region, as well as, our numbers are starting to pick up as well, and wanting to make sure we have all the resources that we need for them too.
Yeah, so you mentioned that you performed your kind of residency training and your education 2015 to 2019, and that you only became like a full-time staff in February of 2019, which was just a few months prior to the pandemic. Can you take us through?
A year, yeah.
Yeah. Can you take us through kind of when you started noticing the situation was becoming more serious, and how the hospitals you were working for had to kind of adapt, and how you personally had to adapt?
Yeah. So I mean, your first year as staff, like when you're finished all of your residency training, in every specialty, but I think definitely emergency, you can be as prepared as you can possibly be from your training, but there's still a steep learning curve in your first year as you get used to doing everything on your own. You don't have a supervisor anymore, so the buck kind of stops with you. So it's definitely a big transition year, a lot of getting used to things. So I was just sort of starting to feel like, okay, I can, I'm feeling more comfortable. I've, seen a lot of things on my own. So I was just starting to get settled into a good groove. And then all of a sudden we were hearing, word out of China and the rest of the world. And it was, I would say at the end of February, there wasn't a lot actively happening, but just lots of conversations. So everyone was kind of on edge. We didn't know what was coming. Everyone sort of said, oh, maybe this, maybe that, but wasn't anything sort of directly affecting us initially. But then once, the cases started coming into Canada and Ontario, the first few cases in Toronto and then into KW, things happened really quickly. I remember there was one day where I started my shift at, I think, 11 a.m. and we weren't wearing masks routinely. We just only in patients that we were concerned about COVID. And then about 3 hours into my shift, there was a big meeting in the middle of the emergency department and said, from this moment forward, now you wear masks and goggles for every patient. And so by the end of my shift, the whole policy had changed over the course of a couple of hours. And you show up for a shift a couple of days later and things were totally different. Everyone was just kind of trying to adapt and make sure we had the safest policies. PPE was a big concern, especially in early days as well. So how do we make sure everyone has what they need, but also not wasting anything? In the early days, we were at the end of a shift keeping our masks. We kept them in a Ziploc bag and they were sort of stored for us just in case we were going to need them again. We never ended up needing them, but it was just, the fact that you even had to think about that you're saving masks because we might run out was, in a well-resourced country like Canada, just seemed like I just never dealt with anything like that before, we might not have enough of something. So that was the biggest thing, just day by day and emails every day, things constantly changing. Like I said, all of a sudden one day I showed up and all those plastic wrap was in so we could make the negative pressure room. So it was quite a transition. Things have sort of leveled off over the last few months. Things have kind of unfortunately become quite routine, wearing masks, all the procedures to minimize risk when we're doing the high risk procedures. So yeah, we're honestly kind of getting used to it, which is a weird thing.
Yeah, so this is actually a question that I've asked several of my guests before, and they've all given different yet equally interesting responses.
Okay.
Going into this pandemic with the training that you have, you mentioned that you started actually working in hospitals around a year before the actual pandemic started. Did you feel kind of prepared to tackle the challenges of the pandemic once it started emerging?
That's a good question. I think most of us, I would say most people in healthcare, particularly certain areas, emergency being one of them, we're pretty used to being flexible. In the ER specifically is really what I can speak to most, of course. We're sort of at the mercy of who walks through the door. So there might be a day where it's not that busy, and there might be a day where hundreds of people come in and we just have no control over that. We have to deal with whatever sort of walks through. So I think that level of flexibility and being willing to do what you need to do to get through the challenge that's in front of you, that was something I've actually felt reasonably prepared for. And fortunately, the team around me, the fellow nurses and clerical staff and all that, we're kind of used to that too. So at least those motions of, okay, let's just put our heads down and do what we need to do. Yeah, I think we were prepared for that. But the unknown, the constant changing, and policies trying to keep up with what was the right thing this day compared to yesterday, that was really overwhelming. I know in medicine we're used to things, trying to keep up with the best evidence and all that, but that usually happens on years timelines, not days. So it was a lot. So I don't think I was quite prepared for that, and also just managing everyone's fear and how patients that came in, there was such a wide variety of fear. Some people terrified, they didn't want to come in. Some people, not worried at all. And that was harder. But I think the, adapting and doing what you need to do, that I actually felt reasonably ready for that.
So I think we hear a lot about the impacts of the pandemic in a larger scheme of things. And certainly it's very difficult for the healthcare industry as a whole to address the pandemic. But could you speak to how those around you and you yourself, especially in the healthcare industry, have been kind of personally influenced by the pandemic? So like mentally, physically, socially, what kind of ramifications are there on serving in the front line?
Yeah, it's interesting. There's a lot of, on the one hand, I actually feel kind of lucky because I still get to go to work every day. I get to see coworkers in person, which a lot of people aren't getting. So, I'm still actually getting a decent amount of quote unquote social interaction and getting to interact with people. Whereas I know a lot of people, depending on where they work, or, they're just at home for the most part. So for me, that's actually been one thing that's been a bit of a saving grace. It kind of gives me something that I'm doing with purpose and, stimulating and feeding that need for socialization that we're not really able to fill in other ways. For me personally, I was actually pregnant when the pandemic started. And so that was just on a personal level, really scary because we just didn't know what the effects were, if I was at higher risk or if the baby was at higher risk. So trying to navigate that. And what the best thing for me to do was, I ultimately ended up actually taking a bit of an early maternity leave just because I didn't know what the right thing was to do from a safety perspective. I also have a toddler at home and her daycare was closed. So that was also part of it. But, it's definitely impacted my family for sure, in that until I was vaccinated, I felt very high risk. And so obviously we were distancing anyways, but feeling that extra sense of responsibility that in case I was carrying or could infect other people, making sure we kept extra distance. For sure, this was always sort of in the back of your mind.
Yeah, that's actually something I did want to touch on. I'm aware that you are a mother. Before our interview, you warned that I might hear a baby in the background or a young toddler in the background.
Yeah.
but
Mhm.
that hasn't happened
They're
so
sleeping
far,
things.
which is wonderful. But as an emergency doctor, how do you actually balance your professional life and your family life? And have you kind of had to cut ends on either side?
It's not easy, that's for sure. I'm pretty lucky right now. My husband's actually taking a paternity leave, so I took 6 months off, and then he's taking the remainder of the 6 months off. So that's been a huge factor, being able to sort of manage things right now. That said, once that's over, we'll go back to the way things were before. And we're really fortunate. We have family around, which is less relevant in COVID, unfortunately, but in non-pandemic times, they were really supportive and helping out with kids and pickups and drop-offs and all that. We have an amazing daycare that makes me feel good about where she's going every day. And even when I can't be with her all the time, I know she's got good interactions and good people looking after her. But it's hard. It's really hard, trying to stay up to date and wanting to be involved on, extra committees and things like that. I think is important for my, just as part of my career and to medicine. But at the same time, it's also important for me to be home for dinner when I can, because shift work, definitely keeps me, I miss bedtimes, I miss weekends. But at the same time, with my schedule, I'm, occasionally free on a Tuesday during the day. And so when my kids are older, I can go on their school trips and stuff. So I'm just trying to find the times when I am available and just maximizing that time and leaning on my village that helps us, since we certainly couldn't do it just on our own.
Yeah, so I actually did want to ask a little bit about the kind of shift work nature
Mhm.
of your occupation. So you've mentioned that you work 8-hour shifts at random, so you can be assigned any day, any time to work.
Yeah.
And something that I've kind of received as a consensus from my other guests is that there's been a large sense of uncertainty and unfamiliarity with the pandemic as a whole. And they've pointed out that it's been more difficult to connect with their patients on a more personal level. They've pointed out that it's been more difficult to connect with their friends and family on a more personal level. Do you feel the same way about that?
Um, I do. It's interesting. I mean, the emergency department is kind of different too, or somewhat unique, because all of our interactions with our patients are pretty brief. We don't follow them for many days in the hospital, or we're not, they're family doctors. So I see them many times. So it's not unusual that I would only interact with my patients for 10, 20, maximum 30 to 45 minutes at a time, and then they sort of move on. But I would definitely agree. So from that perspective, not that different, but missing the visual and facial cues that can help you sort of make a connection in that brief of a time is definitely missing, for sure. Because even if you're only with the patient for 10 minutes, you could usually make some sort of connection, whereas that's definitely harder now without the facial cues. And then from connecting with others, yeah, I mean, most of it is the distancing and, not wanting, following the public health guidelines and sort of keeping to ourselves as much as possible, unless we can be outside, depending on what the rules are. But yeah, that's been the biggest thing, probably.
Yeah, so I think looking a bit into the future, how do you think this pandemic may have shifted kind of the nature of the healthcare industry as a whole? And what changes do you expect to see in your specific field once COVID-19 is no longer as large of a problem?
Hmm. I mean, I hope that it's shone a light on the very big gaps that we have in our system, and the fact that we've been operating at 110% capacity for years before COVID started. We didn't have extra capacity to deal with this, so we're sort of doing a lot of backpedaling, and I guess the one good thing is we're fixing a lot of those things really quickly, and I don't know if they're being fixed in the best ways possible. They're kind of patching gaps to make sure we can keep up with things. So I'm hoping at the very least we come out of this and realize that investing in healthcare and appropriate long-term care and being infection control, not doing hallway medicine, practicing, being able to have spaces to keep people in rooms and separated properly, that's worth investing in, that public health is worth investing in. So I'm hoping on a larger scale, that's what we take away from it. And And then otherwise, I hope that we just kind of all appreciate, the interactions that when we can be with each other, that how lucky we are, and that like circumstances can change and we are suddenly not able to see people like we have been during this, and just having a little bit more sort of compassion for each other, and grace for one another, and just enjoying what we have in front of us.
Certainly. And just as a final question, Dr. Yantzi, you are speaking to largely a high school audience.
Yeah.
Are there any parting words you'd like to offer about what it's like to work as a healthcare professional on the front line, especially during a pandemic of the scale we are experiencing now?
Yeah. Well, like I said, I actually feel really fortunate. Like I said, I have a job, which is good, and it's really special. It's hard for sure, and lots of things that I mentioned have made it hard. But it's such a unique experience. I feel like I'm really a part of something. All of us have sort of banded together, whether we know it or not, to working towards one common goal. So I feel quite honored to be a part of that. When I hear on the radio or see a sign that says, thank you, healthcare workers, it moves me to think, oh, that's me. They're talking about me. So I'm quite honored to be a part of that, and feel like I can make at least a small difference. That said, there's so many other jobs and parts of the hospital, as well as even just other jobs outside of the hospital. So you feel kind of connected to them as well, and trying to just get through this and come out the other side. Mm-hmm.
Dr. Yantzi, I really appreciate your time. Thank you for joining the podcast today.
No problem. Thanks for having me.
Thank you, everyone, for tuning in to this episode of the Stories from the Frontline podcast series. Dr. Yantzi has offered extremely valuable insight into the state of emergency departments across the province and the individuals that are serving in them. We hope you enjoyed our conversation as much as I did. Our next episode will feature Nurse Skura from York Region Public Health, who will offering her inspiring take on the role of nurses during this pandemic, but also as a whole. We hope you can tune in then. Thank you.